Feeling like a balloon after every meal? Is your gut constantly rumbling with discontent? You're not alone. Let's explore SIBO and how to find lasting relief. SIBO, or small intestinal bacterial overgrowth, is a condition where there's an excessive amount of bacteria in your small intestine. This isn't just any bacteria, it's often the type that should primarily reside in your colon. Think of your digestive system as a carefully orchestrated ecosystem. The small intestine is designed for nutrient absorption, while the colon houses a large bacterial population for further digestion. In SIBO, bacteria migrate or overgrow in the small intestine. This leads to fermentation of undigested carbohydrates, producing excess gas. This excess gas is the primary culprit behind the bloating and discomfort associated with SIBO. SIBO symptoms can vary greatly from person to person, making it a tricky condition to identify. Some experience mild discomfort, while others suffer debilitating symptoms. Bloating is a hallmark symptom, often occurring shortly after eating, especially after consuming carbohydrates. You might feel like you've swallowed a beach ball. Abdominal pain or cramping is another common complaint. The excess gas and inflammation can irritate the intestinal lining, leading to discomfort. Excessive gas and flatulence are almost always present. The fermentation process creates a significant amount of gas that needs to be released. Diarrhea or constipation, or even alternating bouts of both, can occur. The bacterial imbalance disrupts normal bowel function. Nausea, fatigue, and even nutrient deficiencies can also be signs of SIBO. The overgrowth can interfere with nutrient absorption, leading to deficiencies over time. Several factors can contribute to the development of SIBO. Understanding these can help you identify potential risks and take preventative measures. Structural abnormalities in the small intestine, such as adhesions or strictures, can create pockets where bacteria can accumulate. These abnormalities disrupt the normal flow of digestion. Slowed motility, or the reduced ability of the small intestine to move food along, can also contribute. This allows bacteria more time to proliferate. Certain medications, particularly proton pump inhibitors, PPIs, used to reduce stomach acid, can increase the risk of SIBO. Reduced stomach acid can allow more bacteria to survive and migrate into the small intestine. Underlying conditions like diabetes, Crohn's disease, and celiac disease are associated with an increased risk of SIBO. These conditions can affect gut motility and immune function. Previous abdominal surgery can sometimes lead to adhesions or other structural changes that increase the risk of SIBO. Scar tissue can disrupt normal digestive function. Diagnosing SIBO typically involves a breath test. This non-invasive test measures the levels of hydrogen and methane in your breath after you consume a sugar solution. The breath test works by measuring the gases produced by bacteria in your small intestine. Elevated levels of hydrogen or methane indicate bacterial overgrowth. During the test, you'll breathe into a collection bag at regular intervals over a few hours. The collected samples are then analyzed for gas concentrations. It's crucial to consult with a doctor or gastroenterologist for proper diagnosis. They can interpret the test results and determine the best course of treatment. Self-diagnosing and treating SIBO can be risky. Treatment for SIBO typically involves a multifaceted approach. This often includes antibiotics, herbal antimicrobials, and dietary changes. Antibiotics, such as rifaximin, are often prescribed to reduce the bacterial overgrowth. Rifaximin is a non-absorbable antibiotic that targets bacteria in the gut. Herbal antimicrobials, like oregano oil and berberine, can also be effective in reducing bacterial overgrowth. These natural remedies have antibacterial properties. Dietary changes, particularly a low FODMAP diet, play a crucial role in managing SIBO symptoms. This diet restricts certain types of carbohydrates that are easily fermented by bacteria. Diet plays a crucial role in managing SIBO and alleviating bloating. A well-planned diet can help reduce bacterial fermentation and gas production. FODMAPs, or fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, are short-chain carbohydrates that are poorly absorbed in the small intestine. These are prime food for bacteria. A low FODMAP diet involves limiting or avoiding high FODMAP foods. This reduces the amount of fermentable carbohydrates available to the bacteria. Focus on lean proteins, leafy greens, berries, carrots, and cucumbers. These foods are generally well tolerated and provide essential nutrients. Avoid high FODMAP foods like onions, garlic, apples, pears, and dairy. These foods are more likely to cause bloating and gas. Consider working with a registered dietitian to develop a personalized low FODMAP diet plan. A dietitian can help you identify trigger foods and ensure you're meeting your nutritional needs. In addition to diet and medication, lifestyle changes can significantly impact SIBO symptoms. These changes can help improve gut health and reduce bloating. Managing stress is crucial, as stress can negatively impact gut function. Practice relaxation techniques like meditation or yoga. Eating smaller, more frequent meals can help prevent overloading the digestive system. This allows for more efficient digestion and reduces the risk of fermentation. Chewing your food thoroughly is essential for proper digestion. This helps break down food particles and reduces the burden on your small intestine. Staying hydrated is important for overall health and digestive function. Drink plenty of water throughout the day. Consider prokinetic agents, but only after consulting with your doctor. These medications can help improve gut motility and prevent bacterial overgrowth. We hope this video has provided you with valuable insights into SIBO and how to find relief from bloating. Remember, managing SIBO is a journey, and it's essential to work closely with your healthcare team. If you found this video helpful, please give it a like, subscribe to our channel for more health-related content, and leave a comment below sharing your experiences with SIBO. What topics would you like us to cover in future videos? Your feedback is important to us. Managing SIBO can be challenging, but it's important to remember that relief is possible. Be patient with yourself, collaborate with your healthcare team, and stay committed to making positive changes. By understanding SIBO, implementing dietary strategies, and adopting healthy lifestyle habits, you can significantly improve your digestive health and find lasting relief from bloating. You've got this.